Hello, I'm Dr. John Kelso. I'm an allergist at Scripps Clinic in San Diego, California, and I'm going to take a couple of minutes to talk about what is an eye allergy. So just allergy in general, I think it's important to know that patients are not born allergic to things, but rather become allergic to things over time. And in the case of eye allergy, we would mostly be talking about becoming allergic to some airborne substance. So the type of things that are in the air that people can become allergic to are things like pollen from grass and trees and weeds, mold spores, animal dander, dust mites. So these are all airborne things that people can become allergic to. And when we say that somebody became allergic to something, what we mean is they generated a certain type of allergic antibodies called IgE antibodies against that airborne substance. And then once you've made those allergic antibodies, with some subsequent exposure, then you might have symptoms. So in the case of the eye allergy, the most common example of that would relate actually to patients who usually also have nasal symptoms. And when they come in contact with these airborne substances, they would have nasal symptoms that would include stuffy nose, runny nose, and sneezing, itching of the nose perhaps, but then also often have eye symptoms as well. So patients have itchy, watery, red eyes. So a patient would suspect that they had an eye allergy typically if they had those kind of symptoms, red, itchy, watery eyes, particularly if they came on in conjunction with similar nasal symptoms, stuffy nose, runny nose, sneezing, etc. Sometimes patients can have a pretty good idea what they might be allergic to because there's some obvious association with when the symptoms occur. So if these symptoms occur when patients are around cats, it's very likely that they're allergic to cat dander. If they occur at certain times of year, when certain plants are pollinating, then it would be likely that they would be allergic to those pollens. So the treatment for patients who have these kind of symptoms with the eye allergy symptoms would be typically antihistamine medications that block the response. And if it's something that the patient can anticipate, so for example, going over to somebody's house who has a pet and knowing they're going to get itchy, watery red eyes, they can take their antihistamine ahead of time prior to the exposure, and that's often helpful. And then for longer term, we have medications that would include, again, if the oral antihistamines were not sufficient for the eye symptoms, there are antihistamine eye drops that can be prescribed that would often be helpful in that circumstance. There are sometimes patients who have eye symptoms that seem kind of out of proportion to their nasal symptoms, where we may think that in addition to the normal kind of eye symptoms that would go along with the nasal allergies would cause us to think that perhaps there's something in addition that's happening with their eye symptoms. So for example, there's a condition called vernal conjunctivitis where patients have usually adolescent males who have symptoms that are eye symptoms that are out of proportion to their nasal symptoms. There's another condition called GPC, or giant papillary conjunctivitis, that happens in patients who wear contact lenses where their reaction in their eyes is not due to an allergy per se, but to a reaction to something that's on their contact lenses. And then finally, there's a condition called atopic keratoconjunctivitis, or AKC, in patients who have eczema or atopic dermatitis, who will sometimes have eye symptoms in relation to that. So there are cases where patients would have something beyond the kind of normal eye symptoms where we might be thinking about some of these other conditions. And then finally, when we say eye allergy, thus far we've been talking about symptoms that really affect the eyes themselves, or the eyeballs, if you will. But there are patients who also have symptoms that affect their eyelids. So sometimes when patients say they have an eye allergy or they have some concern about their eyes, they're really not talking so much about their eyes, but rather their eyelids. And there are conditions that can affect patients' eyelids. There's quite a number of them. But one of the ones that falls into the allergy realm is something called allergic contact dermatitis, where patients might have physical contact with some chemical on their eyelids that would be causing a skin reaction, almost like a poison ivy type of reaction. Sometimes the thing that the patient is coming in contact with on their eyelids is rather obvious, so for example, eye makeup. But sometimes it can be less obvious, or it can be even be a chemical that the patient is touching on their hands through work or hobbies, and then transferring that to their eyelids by touching their eyes with their hands. So again, there may be conditions that patients think of as eye allergy that really relate to their eyelids rather than their eyes themselves. So many of these conditions, certainly an over-the-counter antihistamine medication would be an appropriate thing to try if a patient is having these kind of eye symptoms. But if that's not providing adequate treatment, or if there's other concerns, the appropriate specialist to see would be an allergist, and who can obtain additional information about what's going on with the patient's eyes, perform testing for many of these allergies, and provide additional treatment recommendations. So if you have what you think is an eye allergy, certainly don't hesitate to get in touch with a board-certified allergist to help investigate what may be going on, because in almost all cases we can make those type of symptoms not be bothersome or go away completely. Additional information about this can be found at the website of the American Academy of Allergy, Asthma, and Immunology, the Quad AI website, where you can get additional information on this topic. Thank you.